Today we will talk about what you need to know before going home with your new organ transplant. We will cover topics including daily care, diet, medicines, lab draws, incision care, and when you should contact your transplant nurse coordinator. Daily care. To prevent rejection of your new organ, take your anti-rejection medications every day as directed. Remember, some are once a day and some are twice a day. You should not skip doses. If your anti-rejection pills come in wrappers, do not open them until you are ready to swallow them. You also need to weigh yourself every morning after you urinate and before you dress. Please write this down. You need to check and record your blood pressure, heart rate, and temperature 3 times every day for 3 months. After 3 months, check your weight, blood pressure, heart rate, and temperature once a day. Do not lift more than 10 pounds, which is about the same as a gallon of milk, for the first 3 months after surgery. Do not bend or reach in a way that will stretch your incision. Diet. You should drink 3 liters or 100 ounces of fluids every day unless you have been instructed to drink a lower amount by your transplant team. Tap water is okay to drink. You should avoid caffeine and alcohol. You should also follow a heart-healthy, low-salt or low-sodium diet. Be sure to wash fruits and vegetables well before you eat them. Do not eat pomegranate or grapefruit because it will decrease the effects of your anti-rejection medicine. You now have a weakened immune system, so it is important to do what you can to prevent infection. This means you cannot eat from buffets and salad bars. Make sure all meat is completely cooked. No raw meat, raw fish, or runny eggs. Also be sure to wash your hands frequently to prevent the spread of germs that can cause infection. Medicine. You will likely take 2 anti-rejection medicines twice a day for the rest of your life. Tacrolimus and mycophenolate are 2 anti-rejection medicines commonly ordered by the transplant team. You need to take these medicines 12 hours apart at the same time for the rest of your life. You should not skip any doses. Tacrolimus. Hold your dose of tacrolimus on Monday and Thursdays until after your blood is drawn. Your labs need to be drawn within 15 to 30 minutes of the time your medicine dose is due. Your dose of tacrolimus may change based on your labs. Do not make changes in your medicine unless contacted by your transplant coordinator. Mycophenolate. Mycophenolate is used to help prevent rejection of your new organ. Again, this medicine should be taken twice a day, every 12 hours, at the same time every day. Do not skip any doses. Invarsus XR. Invarsus XR may be prescribed instead of tacrolimus and is also used to help prevent rejection of your new organ. This medicine should be taken once per day at the same time every day. Do not skip any doses. These pills look like this. Sirolimus. Sirolimus is another drug that may be prescribed instead of tacrolimus and is also used to help prevent rejection of your new organ. This medicine should be taken once per day at the same time every day. Do not skip any doses. These pills look like this. Nystatin. This medicine is used to prevent a fungal infection in your mouth called thrush. You will be taking this medicine 4 times a day. Do not drink or eat for 15 to 20 minutes after taking this medication. Valsite. This medicine prevents viral infections that can occur with a weakened immune system. Bactrim. This medicine prevents bacterial infection that can occur with a weakened immune system. Aspirin. You will also be taking an aspirin every day after transplant. Aspirin is given to help prevent blood clots. Colace. Colace is a stool softener used to help keep soft stools after surgery to prevent constipation. You should hold on taking this medication if you have diarrhea. Pepsid. This medicine is used to help prevent heartburn. Lab draws. For the first 3 months after transplant, you will be getting your labs drawn every Monday and Thursday. You will be given a lab order before discharge. Take this letter with you to the lab. On these days, hold your dose of tacrolimus until after your blood is drawn. Your labs need to be drawn 12 hours after the last time you took the tacrolimus. If you have home health coming in, call them to arrange your timed lab draws. Look at your discharge instructions to find their number. You should also see your kidney or liver specialist within 3 months after going home. Be sure to take your medicine list and your record of your vitals to all your doctor appointments. Incision care. The most important thing you can do to care for your incision is to keep it clean and dry. It is okay for water to run over your incision while you are in the shower. Do not take a bath or go swimming until your transplant team says it is safe to do so. You should gently clean your incision every day with soap and water. You should not apply any lotions, powders, or ointments to your incision. Look at your incision daily for signs of infection. It's normal to have a small amount of clear or pink drainage from your incision. Signs of an infection can include increased drainage or a change in the color or smell of the drainage. Other signs of infection include redness, increased pain or hardening of the incision. You should also watch for unusual pain, fever, or opening of the incision. Call your transplant coordinator if you have any of these symptoms. When to call your transplant coordinator. Call your transplant coordinator with any questions or concerns about your transplant care. You should be concerned if you have any symptoms of a cold or flu. Symptoms of a cold or flu include fever, body aches, chills, nausea, vomiting, diarrhea, coughing, or sore throat. You should also be concerned if you have swelling in your feet, hands, or face. You need to call your transplant coordinator if you do not make any urine or if you gain 2 or more pounds in a day or 5 pounds in a week. If your blood pressure is greater than 160 twice in one day, you also need to call your coordinator. Your coordinator can also help you if you have problems getting your medications for any reason. If you are not sure who to call, please refer to the Who to Call with Problems section in your Living with Your Liver, Kidney, Pancreas Transplant book. Thank you.